I'm Elizabeth OKOTH. I'm a public health specialist and a consultant on issues about adolescents' health. I wanted to address triple threat, and the triple threat is what has really been a challenge among the adolescent, especially the adolescent girls and young women in Kenya and also globally. So I'm talking about issues about adolescent or teen pregnancy, HIV and sexual violence. Within Kenya, we are having the teen pregnancy rates and adolescent pregnancy rates have been going high each year. For the past 5 years, we've been seeing the rates ranging from between 20 to up to around 25%. That is among all the women who are pregnant. About 20 to 25% have been adolescent girls between 10 to 19 years. Among this same age range, we are also seeing very high rates of new HIV infections as well as sexual violence. Some of the issues that are really related to this are many, including some of our cultures, like the disco matangas, like the early sexual debut. We also have a lot of child marriages. So in Kenya and also globally, we've turned a lot of focus to really address these challenges among adolescent girls and to see how we can address this, as well as see how to return our children to school. So many girls are also really suffering from sexual violence, and some of the violators are, our people. They are the family members in most of the situations. We have sometimes even their own either fathers or uncles, and sometimes even the teachers. So this is something which has been taken up by the government, and it's being addressed multi-sectorally beyond the health sector. We've had our commissioners have taken up this, we've had the health sector have taken up this, and we are trying to engage the parents to see how we can take and really address these issues. So adolescents are our future, and Kenya, we've had a population bulge where the majority of our population are the young people. So we really need to, to safeguard the health and the well-being of the health of our young people, because these are the people whom, when we talk about our growing economy, when we talk about the outcomes for this country, we really need these young people. The other issue that has really affected adolescents' health is the mental health. And globally, and even in Kenya, we are talking about up to about 25% of adolescents of 10 to 19 years are suffering some mental health issue, and especially the issues about anxiety and depression. And especially when we talk about the adolescents who are out of school, within 10 to 19, it's as high. There was a research which was done, for example, in Mombasa County, and it was up to about 36%. And who are suffering depression, especially among those ones who are out of school. Among those ones in school, it was as high as between 20 to 25%. So we want to address the issue about depression and anxiety among the young people. We've seen so many things. We've seen children committing suicide, children killing family members, children burning schools, and we want to rally everybody. We have the Department of mental health within the school, and we have the school health program, and we have all the NGOs, and we want to see how we can do more preventive and promotive services, so that we really address and try to ensure that these young people do not reach that stage, but that they're able to know how to cope and how to come back, but also to realize when the stress is too much and how to know how to address it. So in short, we want to say that adolescents are really the people that we really need to put all our efforts, not only for health, but to empower them in terms of leadership, in terms of how to invest in their own health care, how to invest in their own, to empower them to take, to be, when we are doing policies, whether it's within the health sector, within the leadership, we need to have their voices so that they're also able to talk about the issues that touch them, because there are so many things that right now are really surrounding the adolescents' health issues. So I just want to say that today, let us all fall back and think about our young people, and especially those who are 10 to 19, because they are assets. They are not, we should not see them as challenges. They are assets, and if we nurture them, if we empower them, if we bring their voices on the table, then we are able to really come up with not only a present but a future which is very strong in Kenya. So within my consultancy services, currently I'm consulting for like the grassroots soccer, which works in about 60 countries globally. So adolescent health issues is a global issue. It's not just a national issue or just a county issue. So when we talk about triple threat, when we talk about issues, for example, about HIV, they are the most affected population. And this is because there are many different factors. There are issues about transgenerational sex, where we have much older men who are getting into relationships with the younger girls. These girls, physiologically or biologically, they are not yet fully developed. So it's very easy for them to contract not only HIV, but other sexual transmitted infections, but also to be affected.